We begin with the coronavirus. Good evening and thank you for joining us. I'm Amanda Gomez.
And I'm Sean Mooney. A public health official in Arizona says COVID could become an endemic by March.
But some other public health experts aren't willing to go that far yet and make that prediction. News 4 Tucson's Eric Fink joins us live from Banner UMC tonight with more. Eric.
Amanda, case numbers are still very high throughout the state, and the executive director of the Arizona Public Health Association says we could reach a peak of Omicron cases in the next few weeks. And he says an endemic could soon follow, in part because he says Omicron is so contagious. Arizona reported more than 20,000 new COVID cases Wednesday, just as one public health official says the pandemic could turn into an endemic in the coming weeks.
My definition of moving to an endemic is when we're no longer doing interviews about it, when it's no longer a public health emergency, when the hospitals are no longer overwhelmed with COVID-19 cases.
Humble believes that timetable for the transition point could be the end of March because he says Omicron is raging through communities.
It is finding people very, very easily because it's so contagious. It's as contagious as measles almost. I mean, that means that it's going to exhaust its supply of naive hosts, people who have never been exposed to either the vaccine or an infection before. And eventually it runs out of new people to infect.
So far, the virus has taken the lives of more than 25,000 Arizonans.
Getting to an endemic place, I guess, is better than a pandemic place, but we didn't have to get there with so many casualties. And that's just so heartbreaking. And I mean, it's really sad.
As we head into the third year of this, University of Arizona epidemiologist Kristen Pogriba-Brown says it's too early to tell if we are on the precipice of the coronavirus becoming endemic. In a statement, she says, quote, "I think we need more time to actually figure out what endemic is. Historically, we determine endemic or baseline levels on 5-year averages. So at least from an epidemiologic standpoint, we have a long way to go before we can even determine those numbers." And Dr. Pogriba-Brown says a new variant could change the ball game. The latest ICU capacity shows 95 open ICU beds statewide. That's only 6%. And according to ADHS, almost 60% of those beds are taken by non-COVID patients. We're live tonight at Banner UMC. I'm Eric Fink, News 4 Tucson.